are some cancers for which we have screening programs, which are effective screening programs. But unfortunately, lymphoma is not a kind malignancy where you have a effective screening program. So to detect it very early would be difficult. Usually, patients come to us with symptoms of the disease, but the catch point here is that if you come earlier, the earliest that you feel something is wrong, or you feel some symptoms which are not going well, you should consult your doctor, not ignore it. Usual symptoms that we should be aware of that can possibly be a lymphoma is that if you have any swelling in your body, or usually the swelling of the glands, sometimes when we get infections, throat infections and all, there are some glands that will pop up in our neck. So those are actually lymph glands. So in lymphomas also, these lymph glands can be enlarged, and it can be either in the neck, or it can be in the armpit or in the groin. These are the usual sites where you have lymph node enlargements. And unlike an infection, usually infections, it will be painful. But in lymphomas, these will be painless. So these will be painless swellings of the lymph glands that usually occur. So you have to get it examined by your doctor. Then you can have the organs in your body, in your stomach, like the spleen. So you can have a bloated abdomen, some swellings in your body. Those are in the later stages. Then you can have symptoms like fatigue, loss of appetite, you can get fever, you can get itching of your body, loss of weight. All those things can also be symptoms of lymphoma. First of all, if you have any of these symptoms, you should consult your doctor. And once the doctor checks, they'll probably get an idea because of the location and the way the glands and all. A doctor can get a fair idea whether it's a lymphomatous process or if it is an infection. So sometimes it might just be an infection. They can give you some antibiotics and the swelling might just go off on its own. If it doesn't, and if it's suspicious of lymphoma, they usually will carry out some blood tests, which will give them early some other markers of the lymphoma may be there in that. Then what usually they will do is they'll get a biopsy from the swollen gland. If the gland is swollen, they usually get a biopsy from the swollen gland. Then from the biopsy report, you will know if it's a lymphoma and also about what type of lymphoma it is. A lot of information can be got from the biopsy. Also. And within a very short span of time, newer drugs which are introduced in the West come to India, not like before, where we had to wait for many years. So almost all the new modalities of treatment are available in India as soon as drug is available. So generally, we treat lymphomas with a combination of treatments. Some of them require chemotherapy, some require radiation therapy, then some of them require immunotherapy, which is a new drugs which are available, and some of them require targeted therapy, depending upon the type of the lymphoma and depending on the stage and depending on the person. All of that, the doctor will decide your treatment. Important thing is not to be scared about it. As soon as you have symptoms, approach your doctor. And sometimes, if the earlier the stage of the diagnosis, you might require less treatment. Generally, as the stage increases in lymphoma, there is a thing that the amount of treatment that you require can also go up. So if you come earlier, you might actually require less treatment also. Now there are a lot of newer drugs available which are less toxic as well as more effective also. So all of these are available in India also, and it's not something to be scared about. It's completely curable.